Today our topic is about the cellular adaptation. It's going to be presented by Dr.Amna Fadul. He's an assistant professor at Trife University, histopathologist. Cellular adaptation, as we are continuing to talk about the cell injury. And we said that the response of the cell injury will have three types of the reversible and irreversible. The reversible, when the stimuli fade, the cell returns back to normal, and then when the fade get out and the cell does not get back to normal, it is irreversible cell injury. The cellular adaptation is a form of the cellular response to the cell injury, but it is taking place about the differences. Cellular adaptation, can we see, it's an early form of the cellular response to cell injury, and then we take reversible or the chemical changes. So the cells. So our objective of this lecture about what is the cellular adaptation, types of the cellular adaptation, and the pathophysiological process of cellular adaptation. As we say, that is a reaction which is induced by the physiological or pathological stimuli. As we mentioned, for the causes later on as a matter of revision, that is, the causes could be physiological or pathological. So in cell biology and pathophysiology, cellular adaptation refers to changes made by the cell in response to adverse environment changes. So any changes in the environment will lead the cell to adapt itself towards these environmental changes. So adaptation are reversible changes in the size, number, metabolic activity, or functional activity of the cell. It is how the cell adapts itself according to change in the environment, whether this change in the environment is physiological or pathological type. The normal cell, when it's facing stress is something dividing a stimuli into stressful condition. Injury is a direct traumatic cause. Still, injuries condition, we see that there is major and severe changes in the cell biochemically and pathophysiologically. Stress, it means an adaptation. It can be considered as a mild or not a mild, but it's not a direct injury to the cell. But there is a change in the environment where the cell usually lives. So adaptation, which could be in different form, either in the size, in the number, in the activity of the cell, of the activity of the cell membrane, or the activity of the cell. When the adaptation is being exceeding the time, when the stimuli fade, then the cell returns back to normal. But if the stimuli continue, the cell will lead to cell injury, usually leading to reversible, which is the biochemical changing, and irreversible. يعني احنا بنقوم بنعتبرها نوع من انواع الريسبونس للانجري depending على التايب بتاع الانجري, depending على التشينجز اللي بتحصل داخل السيل. So when you have a significant damage or insult, we call it cell injury. طيب adaptation. كلمة adaptation يعني literally it means تعود, to adapt itself, to get used about the environment. So the cell, either according to the underlying causes, adaptation could be due to physiological process like hormones, or pathological process like environmental factors, microorganisms, infectious conditions. This is called pathological process. The morphological features of adaptation could be atrophy, hypertrophy, hyperplasia, or metaplasia. And we are going to think about each one separately. Atrophy, it is a decrease in the size of the cell by loss of some cell substances. When sufficient number of cells are involved, the entire organ or tissue decreases in size and become atrophic or shrinking in size. And the commonest condition for this is age. Aging process leading to an atrophy, brain atrophy, muscle atrophy, organic atrophy. All these are the commonest factor is the age. So the pathophysiological process occurs bringing into the balance. السيل هي عايزة تعيش The cell wants to survive for the last moment. In the phase to reduce the blood supply, nutrition, the causes could be decreasing blood supply, nutrition, that the cells become smaller with diminished function and thus reduce their metabolic needs, and by doing so they escape injury. هي الفكرة بتاعت الادابتيشن or reversible cell injury كلها processes to the cell wants to survive. Whatsoever, even if there is a change in the environment, the cell will survive. So some cells will, to face these conditions, they are going to be atrophic. So reduction in the size is due to reduction in the number of structural components. The mitochondria and myofilaments and endoplasmic reticulum will increase, will decrease in the number of echo. But as the causes for this, sorry, Jamal. So, because it would be decreasing the workload, then muscle atrophy due to immobilization, the fractured bone. عشان كده يقول لك بيعملوه في الثيرابي. You need to put reduction in the muscles being relaxed for a long time without activity. This will lead to reduction in size. So denervation or reduction or any cause will lead to denervation or loss of the nerve supply, then paralysis of the limb due to nerve injury or poliomyelitis is the cause of muscle atrophy. So blood supply, nutritional supply, denervation, ischemia, here blood supply, brain atrophy as an aging phenomenon due to atherosclerosis, undernutrition as in starvation and kwashiorkor, here common with children. Loss of endocrine stimulation, atrophy of the gonads in female and male, or atrophy of the uterus in the reduction in the atrophy of the gonads, whether in the male or in a female, either in the gonads, testis or the uterus, due to age, due to loss of hormone, لأنه بعد فترة الage المينوبوز مثلا. So all these are examples of an atrophy. So atrophy is a reduction in the size of the cell due to many causes: reduction in the blood supply, reduction in the nutrition, reduction in denervation, immobilization, aging process. All these are leading to an atrophic process, which is decreasing in the some numbers of the cellular components and shrinking of the cell size. This is the normal muscles, and this is the atrophic or atrophied muscles. Type. Hypertrophy is a form of cellular adaptation. The cell wants to survive, which is the completely reverse or the completely opposite of hypertrophy, which is increase in the size of the cell. And as a consequence, the size of the organ or tissue containing them will be increased in the size, and this is the reverse or opposite to atrophy. The physiological process due to excessive workload induces increasing in the cellular constituents, more enzymes, more mitochondria, ATP production, and more myofilaments. It is due to synthesis of more structural components of the cell, and more enzymatic, more mitochondria, and more myofilaments. The most famous example of hypertrophy is the heart. So it could be physiological due to hormones like a uterus in pregnancy. There is increasing in the number and in the production of the hormone, which is progesterone, which is increasing the size of the uterus, mainly the endometrium, and the thickness of the wall, increasing in the size. So physiological hormones, skeletal muscles in the athletics, which is physiological, increase in the workload, and pathological اللي هي في الهارت, left ventricular hypertrophy or cardiomegaly, that the work it occurs due to when the heart being pumping against the high pressure. So this is increasing in the workload of the muscles. The muscles adapt itself towards this condition by increasing in the size of the cell. So hypertrophy is increasing in the size of the cell, and we call it in the heart. It is cardiomegaly or left ventricular hyperplasia, and the ventricle has to contract against increased pressure of the aorta. You see increasing in the size of the cells, and this will increase in the load of the organ. So this is the normal heart as you see here. ما أعرف أنا ظاهر لكم السهم ولا لا. So this is the mitral valve. This is the apex of the heart will be increases which lead to cardiomegaly, usually left ventricular hypertrophy. بيحصل thickening في السبتم of the muscles. طيب الhyperplasia, it is an increase in the number of the cells in an organ or the tissue leading to an increase in the size. Hyperplasia and hypertrophy are closely related and often occurs together in estrogen-induced enlargement of the uterus during pregnancy. برضه في اليوترس بيحصل فيه hyperplasia بيحصل فيه hypertrophy. لكن the most common to occur في اليوترس is hyperplasia, increasing in the number of the cells. The most common example, hypertrophy can occur in the uterus when we have a pathological condition. Hyperplasia is common in the uterus, and hypertrophy are closely related, and other occurs together. في اليوترس بيحصلوا الاثنين، بيحصل hypertrophy والhyperplasia. لكن common is to have a hyperplasia. And in estrogen-induced enlargement of the uterus during pregnancy, there is both hyperplasia and hypertrophy of the myometrium. تمام؟ Not all other cell types have the same capacity for hyperplasia, which means that the cell itself, the cell of origin, has the criteria to be hyperplasia or hypertrophy. تمام؟ So hypertrophy is increasing in the number of the cells. يعني heart cells does not have the ability to have a hyperplasia, but they have an ability to have a hypertrophy, which is increasing in the size of the cells and not the number of the cells. So hyperplasia, there is usually we have three capable of cell division: labile cells, and can undergo profound hyperplastic growth, those of the epidermis, mucosal surfaces, hepatocytes, fibroblast, and bone marrow. The cell of origins which show which type of cellular adaptation this cell will take place. The liable cells have the ability to increase and to be multiplied, to be hyperplasia, increasing in the number. The epidermis, the liver. عشان كده الناس الليفر it's a small piece of liver tissue ممكن تعمل لها transplantation. You don't need to be transplanted the whole cells, because the type of the cells itself will show the type of adaptation which take place. So on the contrary, nerve cells and those of the heart and myocardial cells and skeletal muscle fibers have no capacity to hyperplasia لأنهم permanent cells. They don't have an ability to multiply. They have an ability to increase. The heart has an ability to be hypertrophied rather than to be hyperplasia. Also, hyperplasia could be physiological. اللي هو hormonal, بيحصل proliferation of the breast glandular epithelium in female at puberty or during pregnancy. This is physiological hyperplasia. It's not a pathological. لكن أنا عندي الهرمونال stimuli بيبقى very high. حتى أثناء المنسترال cycle الهرمونال secretions of hormone will be very high. The cells will be hyperplastic. بيجي في البيوبرتي بيحصل لك increasing في number of the cells of the breast glandular cells. Compensatory اللي هي after the partial hepatectomy. عشان كده الزور اللي بيشيلوا منه لازم له نوع السل. عشان كده الترانسبلانتيشن بتاع الليفر ممكن بحته صغيره قدر كفه ايدك تديك تعيش النفرين. فدي is a physiological process depending on the type of the cell. Pathological في hyperplasia يكون either to excessive hormonal stimulation, endometrial hyperplasia, or the effect of growth hormones. When these productions of hormones or this production of cells will be in pathological condition due to adenoma, due to malignancy, due to whatsoever the condition, there is an excessive and there is no fading out of this condition. So it could be pathological and it could be pathological. من الهايبربليزيا احنا هنا بيحصل endometrial hyperplasia لكن بيحصل myometrial hypertrophy. So this is the most common features في endometrial hyperplasia. طيب what is metaplasia? الميتابلازيا احنا هسه عرفنا ان cellular adaptation could be atrophy, could be hypertrophy, could be hyperplasia. Hyperplasia increasing in the numbers of the cells. Metaplasia, it's a reprogramming of the cells. It is a replacement of one mature cell type and another different nature of the cell. طيب pathophysiological process إنه الميتابلازيا refers to transformation of the cells likely represent a reactive or reparative response to some chronic injury or irritation. Does the term change or alter differentiation of the cell due to reprogramming of the cell formation? اسمها reprogramming. كلمة reprogramming دي مهمة شديد في الميتابلازيا. هو ما تغيرت السيل، ما changing, mainly changing. It's a reprogramming of the cells, which is why we have reprogramming changing or reprogramming of the cells, because the stimuli are, and still we depend that the changing or the adaptation of the cell depends on the nature of the cell. So squamous metaplasia of the laryngeal and bronchial respiratory epithelium to be habitual smoking. It will be the normal cells which are found in the lung are columnar ciliated. صح؟ When you have smoking is an excessive, it's an stimuli, it's an abnormal situation للسيل. السيل المفروض ما يكون فيها جهة دخان. صح؟ لحظة دقيقة. So it's a normal to be columnar epithelial. لكن columnar ciliated. Again, when the stimuli smoking is continuous smoking, is a continuous stimuli. So the cell to adapt it will change to squamous metaplasia. And the problem is of the metaplastic cells. This is the normal cells because اللي هي دي احنا a common example لنا تاني احنا هنا الباراسويسوفاجس. الاسophagus, the lower part of the physiology of the lower part of the esophagus is squamous epithelium. لكن الجوبلت سيلز والادرينال والفولومينال سيلز والجلاندولار سيلز موجوده في الاستومك because due to the presence of acid. لكن if you have regurgitation or reflux النزول لما نرقد يقوم جزء من الاسيد ده يمشي للاسوفاجس due to problem in phoenix cells or underlying cause. يقوم جزء من الاسيد ده يمشي للlower part of the esophagus. After a time the esophagus will change itself from the columnar epithelium, from squamous epithelium, it will change to columnar, which is the features of the gastric. ده هتلقى الجوبلت cells. ليه؟ عشان to facing a change اللي هي حصلت لي to adapt itself للاسيد لان السكويمس ما بيتحمل الاسيد. لكن الكولومينر والجلاندولار بيتحمل الاسيد. So most common example for plastic changes is changing of the columnar ciliated epithelium in the lung into squamous epithelium, and the parasesophagus, which is the changing of a squamous epithelium of the esophagus into columnar epithelium. And this is the most common type, famous type of metaplastic changing. And the problem of metaplasia is that after a time it will be these plastic changes, and these plastic changes is irreversible. So we have from this lecture that we know that cellular adaptation, it is the cellular response to change in the environment. And there are adaptation in form of reversible response to the stress. And the underlying stress could be physiological or pathological. And we have different morphological types with different pathological processes can take place: atrophy, hypertrophy, hyperplasia, and metaplasia. It's a very short lecture, it's a very interesting lecture, and a cellular adaptation دي جدا بحبه لأنه حاجة very precise and to the target point. طيب في أي سؤال؟
شكرا دكتورة.
الله يبارك فيكي.
No, thank you. يديك العافية دكتور.
اوكي انا كان عندي معكم محاضرة بعد اسبوعين محاضرة السبيشال تايب اوف هيلينج. من healing and repair reduce managing healing and repair والسوشيال سايد healing and repair. طيب في أي سؤال؟